Hello everyone, I am Dr. Sahithi Balmuri, consultant obstetrician and gynecologist at KIMS Hospitals, Gachibowli. Today we are here to discuss about diabetes in pregnancy, also known as gestational diabetes mellitus. Now why does this happen? This happens when the body is not able to produce enough insulin to meet the extra needs of pregnancy. Insulin is the hormone that controls the blood sugar. Due to lack of insulin, there is a buildup in blood sugar leading to diabetes. Now, this generally develops in the second or the third half of the pregnancy, that is in the second trimester or in the third trimester. And women in India are at a higher risk for developing diabetes. The incidence of this disease is around 9 to 16% in India. Now, who are the women who are at risk? Women who weigh more, that is, whose BMI is more than 30 kg per meter square, or women who've had a previous child weighing more than 4 kgs, women whose family history has diabetes mellitus, or women whose siblings have diabetes are at higher risk. Now, what are the risks associated with diabetes in pregnancy? Now, women who have diabetes in pregnancy have a higher chance of abortions, higher chance of developing babies with congenital anomalies, that is, malformations of the baby, or have higher risk of developing polyhydramnios, that is, excess liquor, have a higher risk of developing hypertension along with diabetes, and a higher chance of a cesarean delivery due to a malposition or an obstructed labor. In the baby also there are certain risk factors like large for gestational age. These babies tend to grow more than the intended weight, but this is not a healthy weight. These babies tend to have more neonatal jaundice, hypothermia and hypoglycemia after delivery. Now, how do we test women for diabetes? Generally, as India is a high endemic area for diabetes mellitus, all women are screened for diabetes between the 24 and 28 weeks with a test known as oral glucose tolerance test, nothing but OGTT, where a woman is called in a fasting state to the hospital and given about 75 grams of glucose mixed in water and asked to consume it. A blood sample is taken before taking this fluid and again after 1 hour and after 2 hours of taking the fluid, and the values are measured. This is done as a routine procedure for all women between 24 and 28 weeks, but women who are at high risk may require to get this test earlier in pregnancy. Now, what do you do if you have been diagnosed with diabetes? Not to worry, you need to consult a good obstetrician who can guide you with the change in the medication and the diet plan. You may also require an endocrinologist opinion. The main management of diabetes starts with diet and exercise, followed by certain medications when required. Stay informed, stay healthy.